noticing that your shoulder already becomes stiff all of a sudden, or it's becoming already painful upon all motion, this might be what is called frozen shoulder. And in this video, we will be tackling on what is causing it, what was the reason behind it, so stay tuned. Feel well at FadiSab. Now, frozen shoulder or adhesive capsulitis, it's an unknown cause. What really happens is that your joint capsule gets restricted because it will get thickened. Simple daily tasks like changing your clothes, doing anything that you usually do is already becoming difficult or painful. Then this is one of the hallmark of why you are having frozen shoulder. If you're having one of these conditions that could contribute to why in the first place you have frozen shoulder, which are diabetes, hypothyroidism, hyperthyroidism, or coexisting shoulder joint like rotator cuff tear. Now, if you have one of these conditions, this can be a risk factor that you are more susceptible to have frozen shoulder. And also one fact that female has more susceptibility can trigger the frozen shoulder with them than men. Now, frozen shoulder actually divides into 3 stages, which is the freezing stage. This is where it is most painful and stiff. The second stage, which is the frozen stage or the adhesive stage, this is where the shoulder gets more stiff and it's still painful, but not as painful during the first stage. And the third stage, which is the thawing stage, this is where the shoulder becomes more freely, more mobile, and the pain also decreases. Now, the good news about this one, this can be treated. Now, surgery is not the only option. We always advise for the conservative management, which is physical therapy. We tailor treatment plan that is best suited for the patient because we need to know what really happened and what is causing it aside from why you are having your frozen shoulder. Do not engage with any exercise that you don't know if it will benefit you or not. You might not know that that kind of exercise would actually create more problem to the shoulder joint. So it's better to consult your doctor before doing anything with this condition. But I want you to know that if other patients who were suffering with frozen shoulder got rid of it, then I am sure you can also. I know this condition is actually very frustrating because we've handled hundreds of patients with this condition. And I know how it's limiting you to move around, prohibiting you to do your daily task. As long as you believe in yourself and the treatment and being consistent with your therapy, then everything will be as planned. Now, don't let this condition ruin your life or limit you for good. Feel well at FadiSab. Feel well at FadiSab.